Hello everyone, this is Dr. Aiyan. In this video, we will talk about the anatomy of the male reproductive system of the dog. So we will talk about the different layers of the scrotum and the testicles and all related structures. So let's get started. Now we will go through the male reproductive system and let's start outside here. We can see the penis here covered with this skin or with this fold called the proboscium or proboscis. This skin is there to protect the penis from outside. If we take the penis like this, so we can see the glans penis. So as we said before, the glans penis is protected by the proboscium here or proboscis. We will open the proboscium later to look at the penis and the different parts of the penis. But here, let me just tell you that as we have a dog here on the table, so I can palpate what's called the os penis inside the penis there, so it's a bone. Okay, if we move caudally here, we can see this external sac called the scrotum, where we can palpate and find, the testicles inside the scrotum. Let me just tell you that before birth, the testicles are inside the abdominal cavity. And at the birth, in some animals after birth, 1-2 weeks, the testicles will move through the inguinal canal, and finally they are located inside the scrotum. The scrotum is there, of course, outside the body in the caudal area of the inguinal region, here to protect and cover the testicles. What we are going to do now is to cut the different layers forming the scrotum completely, and after that I will come back to you to show you the different layers. So see you soon. Said before, we cut some of the layers of the scrotum. Let me show you. So from outside, of course, we have the skin with hair, like the skin which we know. Under the skin, the subcutaneous layer here is a little bit different from that one in other parts of the body. The subcutaneous layer here called tunica dartos. Tunica dartos has a lot of elastic fibers and smooth muscle cells, in the way that the skin can be contracted to push the testicles toward the body in the winter, for example, to give more temperature to the testicles. In summer, the elastic fibers and the smooth muscle cells inside the tunica dartos will be relaxed in the way that the testicles with the scrotum will move away from the body to reduce the temperature of them, So skin from outside. From inside, we have the tunica dartos. Just under the tunica dartos, here we dissected the next layer, which what's called the external spermatic fascia. So this fascia here, as you can see, this is the external spermatic fascia. Is actually, if we continue here, we will find that this fascia is a continuous of the external fascia found in the wall of the abdominal cavity, so abdominal wall there. But here in this area, we will give it a special name and name it as external spermatic fascia. So under the tunica dartos, the external spermatic fascia, this one here. After that, you will find the testicle located inside what's called the tunica vaginalis or vaginal process, the vaginal process. Before we open the vaginal process, let me just tell you that on the vaginal process here, we can see a very thin muscle. This red structure here is the cremaster muscle. The cremaster muscle is a branch or extension from the internal abdominal oblique muscle from the abdominal wall, which move on the spermatic cord here and located finally on the vaginal process. This muscle is responsible also to move the testicles toward the body or away from the body. Okay, so now this is extremely important, guys. So it's not enough if we are going to do the castration here. It's not enough to have the testicle like this inside the vaginal process and to suture the structures at this level. So here we have to remember that the testicle and the spermatic cord, including, of course, at this level here, the testicular artery, testicular vein, all of this stuff, you know, are located inside the sac. If you just suture the sac and all internal, you know, the structures inside it, so in this case, you may have a problem that the arteries and veins can move and slip inside the sac to the abdominal cavity, and after that there is a bleeding, and you have to repeat and open the abdomen at that case. So in this case, if you are going to do the castration, you have to open the vaginal process. You have to open the vaginal process. I will try to do it carefully here. So you have to open the vaginal process, and once you open the vaginal process, you can see the testicle inside it. I will try to open it this way here. So yes, it's like a sac surrounds the testicle and other structures found in this area here, the spermatic cord with the testicular artery and vein. So now, yes, we can see the testicle, and that's what we have to do. In the castration, you have to open the vaginal process, and after that, you have to suture the structures at that level there, up here. Good. In this case, so we talked from outside. Let me just put it again. We talked from outside. We have the skin, the tunica dartos. After that, we talked about the external spermatic fascia. This fascia here, where is it? The external spermatic fascia. So the next layer will be the internal spermatic fascia. Internal spermatic fascia, the fascia which we can see here, this superficial, you know, this structure here. The internal spermatic fascia is also a continuous of the internal fascia inside the abdominal cavity. So the outside layer of the sac, the vaginal process, presents the internal spermatic fascia. The internal surface of this sac is actually the parietal. Let me just, for your information, it's inside the abdomen. It was the parietal peritoneum, and here we will name it as the parietal vaginal tonic. Here, to let you understand what I am talking about, so imagine that the testicle was inside the abdominal cavity, and so that means inside the peritoneal sac there, and after that they move through the inguinal canal to the scrotum. On the way, they push the parietal peritoneum and all other layers here with them, and that's why we can see this one here is the parietal vaginal process, you know, and the visceral peritoneum, they were inside the peritoneum, so that means they were also covered with the visceral peritoneum. So here, the visceral peritoneum called the visceral vaginal tonic. So we have the parietal vaginal tonic here, visceral vaginal tonic on the testicle itself, and that's why we can, this shiny layer here, and that's why we can also give it a name, epiortium. So the visceral vaginal tonic, or the epiortium, the cavity between the visceral vaginal tonic and the parietal vaginal tonic, called the cavity of the vaginal process. Now, let me just show you. So here, this is the different layers. We may go through them later. Here, inside the vaginal process, you will find that the testicle is fixed to the vaginal process by what's called here the proper ligament of the testicle, or the ligament of the tail of the epididymis. Okay, let's stop here and look at the let's continue talking about the testicle itself. The testicle, here inside we have the testicle. Next to the testicle here we have what's called the epididymis, which we can divide into three parts. This is the head of the epididymis here, the head of the epididymis. Here we have the body of the epididymis, and finally caudally here we have the tail of the epididymis. This is the tail of the epididymis. Okay, so head, body, and tail. Head of the epididymis, body of the epididymis, and tail of the epididymis. Okay, between this is the lateral surface. This is the lateral surface of the testicle, where we can see the head, body, and tail of the epididymis. On the medial surface, here we can see the tail of the epididymis. From the tail of the epididymis, we can see this duct moving like a zigzag. I hope it's clear. Zigzag here. This is what's called the vas deferens, or the deferent duct. Vas deferens, or the deferent duct. Okay, to transport the semen, toward the, to outside. Okay, good. Here on the lateral surface of the testicle, between the testicle and the epididymis, we can find here a small fossa, or small area here called the testicular porta. The testicular porta, it's always oriented laterally, so we will use this to know which side is the left side, which side is the right side of the testicle. And I will tell you later how to know if this testicle is the right or the left testicle, even if they are separated from the body. While on the medial surface, we cannot see the porta testicularis or the testicular porta, but we can see the vas deferens. The vas deferens. As you can see here, the vas deferens is also fixed to the spermatic cord here by what's called the Meis ductus deferens, or the mesentery of the vas deferens here, this one here. Okay, this one here. Okay, good. From the testicle upward, here we have the spermatic cord. The spermatic cord, as you can see exactly, we can see here the testicular artery surrounded by a zigzag testicular vein, forming at this level what's called the bambiniformis plexus. So plexus bambiniformis, or bambiniform plexus. Good. Here, from the spermatic cord and from the testicle toward the vaginal process, we have another mesentery here called the mesoortium. The mesentery of the testicle. Okay, inside the now we can move here, and inside the vaginal process, we will find that the testicle and the epididymis are fixed to the vaginal process. Again, this is the vaginal process by what's called here the ligament of the tail of the epididymis, because it extends between the tail of the epididymis to the vaginal process. At the same time, let's just put the testicle again inside the vaginal process like this. Okay. And after that, we will find, I will show you how the vaginal process also is fixed inside the scrotum by what's called the scrotal ligament, which we cut some of them here. So the vaginal process is fixed inside the scrotum by what's called the scrotal ligament. So that means there is a ligament extends between the outside surface of the vaginal process to the scrotum here, the scrotal ligament. Okay, good. Now allow me to follow, if we go through, if we follow the vas deferens here, we will find how the vas deferens moves inside the inguinal canal, and finally we can see it inside the abdominal cavity here. This is the vas deferens, and I will show you that it moves like this. Look, sorry, here, look. So this is the vas deferens. It moves just, to collect the semen here and transport the semen. It will go with the spermatic cord through the external inguinal ring, which is located and formed here in the wall of the abdominal wall. And after that, it moves inside the inguinal canal. I will try to open the inguinal canal later. And after that, it leaves, the inguinal canal through the internal inguinal ring and moves finally here, make a curve over the lateral ligament of the urinary bladder, and moves finally and meet with the other one on the other side here. Look, these two, it forms both of them. They form this enlargement here called the ampulla of deferent duct, or the ampulla ductus deferentis here, and finally they meet together and go to the urethra, okay, or to the urethra. Here between the two vas deferences, here we have this fold called the genital fold. Genital fold extends just between the two ducts here, okay. I hope it's clear. Let me just move the urinary bladder like this and show you this view here, where you can see the both ductus deferentis and the ampulla ductus deferentis, these two, and the fold between them. Okay, again, let me just make sure that this is the vas deferens as we described. You have to find it here, and after that, look at this area here. I'm trying to pull it from here and also from that side. This is the vas deferens moving through the inguinal canal. The same, of course, we described here the right testicle, and the same will happen for the left ventricle, which is still here inside the scrotum, inside the vaginal process. Again, this is extremely important, guys. If you want to conduct like a castration, in this case, you have to open the vaginal process, and after that, you can bend, or you can suture the testicular artery and testicular vein, and of course, in this case, you can also suture the vas deferens. Okay, so here let me just tell you again. Even I will remove the ligament of the tail of the epididymis here, and this way. So imagine that we have the testicle outside the body like this. How can we know if this testicle is the right or the left testicle? In this case, let me just tell you that we have to know where is proximal, where is distal, where is medial, lateral, caudal, cranial, okay? So up is the area where we have the spermatic cord. Down is the area where we have the tail of the epididymis and the ligament of the tail of the epididymis. Caudal and cranial is the caudal is the surface where we can find both actually the epididymis and the vas deferens. Cranial surface of the testicle is the free surface here, where we cannot find the epididymis and the vas deferens. So now this is caudal, this is cranial. Now we just need to know where is medial, where is lateral. So lateral is the surface where we can find the epididymis, and especially again the bursa testicularis, or the testicular bursa here. Okay, so that means this is the lateral surface. The medial surface where we can find the vas deferens. Again, if this is medial, this is lateral. So let's say I put it like this. So this is the dog. Here is cranial, lateral. That means this is the right testicle. The right testicle. Good. Here we open through the abdominal wall completely, and now we can follow up exactly here the spermatic cord. Here I just want to show you this muscle here again, moving on the vaginal process. This is the cremaster muscle. Is a branch of the internal abdominal oblique muscle. It moves through the inguinal canal also, and as I said before, it's located on the vaginal process. This is the muscle here again. This is the muscle here. It moves through the inguinal canal and inserts to the vaginal process. So contraction of this muscle will pull the testicle up toward the abdomen, the body. So this is the cremaster muscle. We just cut it here while dissecting. It's a branch of the internal oblique abdominal muscle. Here, if we put the muscle to the side, here we can see the vas deferens plus, as you can see here, plus the testicular artery and testicular vein. They move here exactly at this level in the wall of the abdomen. We have these two openings. I will put something inside it like this, just like this, and you can see what I am talking about. From this side here we have the external inguinal ring. From this side here we have the internal inguinal ring. On the way, of course, I cut the muscles, guys. I cut the muscles. On the way we have the inguinal canal, where the vas deferens plus the testicular artery and vein move through the vas deferens as described. It will go meet the other one on the other side and goes to the urethra, while the testicular artery and testicular vein, this is the artery. Look, I'm following this artery here. So this is the testicular artery and testicular vein. This is the testicular artery and testicular vein. The testicular artery comes directly from the abdominal aorta. If we move the dog a little bit like this, you will see how the testicular artery comes directly from the aorta. So this is the other one. This is the other testicular artery, again from the abdominal aorta. The testicular vein will go directly to the caudal vena cava. So here again we have the three structures which move through the inguinal canal, including the testicular artery, testicular vein, and the vas deferens and this is extremely important, as inside the operation, if you don't have access to the scrotum and if the animal is completely covered and you open the abdomen, of course, in this case, you will know if the animal is a female or male. If you find something like this, the vas deferens, so that means we have a male animal. Thank you very much.